All right. Good morning, everyone. It's 8:01. I know we're on a short time period, so I want to respect your time and get started here. Thank you all for being here this morning. My name is Carrie Tyson. I'm the executive director here at Portland Downtown. We know that you're still drinking your coffee and getting ready for the day. So I understand that some of you may have your cameras off and that sort of thing. That's no problem. We know, like I said, that you're probably getting ready. So if you want to use the chat function, that's certainly welcome as well. We do ask you mute yourself unless you're speaking. And we're going to go pretty much straight into it here. We've got a great panel this morning who's going to be answering some of the community questions. We are recording this. And there is an FAQ section up on the web, I think, that we linked out, and we can send out that link later. But I want to thank you for being so interested and involved in your community. I'm going to quickly introduce our panel, and then I'm going to turn it over to Kristen for a short little presentation, as I noted on the agenda yesterday. Again, like I said, we ask you to use the raise hand function when you can, and use the chat as well. And I'll be keeping an eye on that and try to facilitate that conversation. Some of you may have been entered as me if you used my link in my email. Apologies for that, but if you get a chance, please do change your name so I can call on you if you have a question. We're welcome to having Kristen here this morning. She's the Director of Health and Human Services. We've also got Greg Mitchell, who's the Housing and Economic Development Director. Bob Fowler and Ryan Gorno are also with HHS, so we appreciate that. With that said, I've got a couple more in the waiting room. Let me admit them. And Kristen, I'm going to go ahead and turn it over to you.
Wonderful. Thank you. Oh, I'm hearing some kind of echo. I don't know if someone's not on mute, but
if folks will mute themselves, if you're not speaking, please. Thank you.
So I am going to share my screen here. Let's make sure this works. And I just have a brief presentation. It's really an abbreviated version of the presentation that I did to Health and Human Services, a Public Safety Committee meeting the 13th. So a little bit ago now, about 10 days ago. And we'll just go over this quickly because I know this is really for questions for you all. But I just took some high level points that I thought folks on this call would be interested in, and I will go over that quickly. Okay, so this is about the co-location of key HHS programs at 39 Forest Ave. These are the proposed programs in divisions that will be co-located there. We have our Health and Human Services Administration, which is me, and our deputy director, and a few others that are currently located here at Portland City Hall. There is our HR and financial teams for both public health and social services. They're currently located at two different locations, here at Portland City Hall, and then also at 196 Lancaster Street. And then there are some individuals who go back and forth, but those are the two locations for those. Our public health division, so this would be all of our public health division. And the current locations for our public health division are City Hall, 103 India Street, the Reiki Community Center, and we do have one individual who is currently seated up at the Cummings Center up on the hill because there's no more room here at City Hall because of the social distancing, and we've had to reconfigure some things. And then the social services division, which is from there, it's all of the current location of 196 Lancaster Street. So it is not, obviously nothing to do with the shelters or anything like that. Those will be staying, but it's the 196 Lancaster for social services. And this was on the previous slide, but once again, I thought it would be important to look at the programs for each that are going to be relocated there. They're being proposed to be relocated. And the hours of operation, really. So we have our Portland Community Free Clinic. The schedule is Monday through Thursday, 9 a.m. to 9 p.m. These are all appointments. And Friday, 9 a.m. to 12 p.m. Those are, that is when staff is there, and also during some clinic hours. We have our STD and HIV clinic. That's appointment only on Tuesdays and Thursdays from 10 a.m. to 5:30 p.m. and flexibility to meet patient need. There, our minority health program, which is currently located at Reiki, that they don't see people in the office. They will go out into the community, but that is the typical schedule. Our maternal and child health program, once again, currently we're not seeing any. We used to host play groups and things like that. We're not doing that right now because of COVID, but we do go out into the community and do home visits. Our nurses do. Our tobacco and lead poisoning prevention program, our healthy eating, active living, and our substance use prevention programs, all of those are programmatic, really. So it's staff working in and working with individual businesses. Some of you may have worked with them actually on various initiatives. And then we have our harm reduction services, which includes our needle exchange program, which does see clients. And our in-house hours are Monday through Friday, 9 a.m. to 5 p.m. And they do community outreach that happens on the weekends. Our research and evaluation program, which is the individual who is up on the Cumming Center. So it's a one-person program. And then our public health administration. And then these are all the social services that programs that are located at 196 Lancaster Street. I know we talk a lot about general assistance, but there's a lot more that is there. You'll see the hours here are all between about 7:30 and 4:30 being the latest. It's our general assistance, our workfare, our hire program, representative pay program. You can see all these, and then security, housing navigation, housing retention. So all of these individuals work with clients, both on the phone. And I think that's an important thing to note. I'm talking to Ryan earlier this week. They are taking right now because of COVID, things have shifted some, and we're doing mostly appointments, and then also a lot of work over the phone as well. So not as many people in the office. And then this is the new program that we are proposing to start, and that would be housed at 39 Forest, our prevention and diversion program. We have not started it yet. We have not hired the staff yet. We have secured some funding for it, but we have no space to hold it. It is separate from the shelter systems, and we would have it in a different location. And the proposed schedule for that is 7 days a week, from 12 to 8 p.m. And we would see individuals in there. They would meet one-on-one with a counselor, and would have the ability to try to reconnect them to resources so they don't have to enter the shelter system. And if they did need to enter the shelter system, we would refer them to and help them fill out paperwork for a shelter. And I think another important note is that transportation is provided. We have funds to purchase a van, and we would always provide transportation. We would never ask someone to walk to any location that they needed to go to. A description of the Forest Ave space. It is 37,000 square feet. It's broken up into 2 levels, and we would separate them based on programs. I'm going to go over the diagrams really quickly in a minute, and I can talk more about the entrances. That has been a question. We also addressed it in the FAQ that was uploaded yesterday, I believe, on the website, but I can talk more about that when you can see the drawings. I think it'll be a little bit easier. But this space allows plenty of space for all of our programs. In addition, it allows us space to grow and do some other things that we haven't been able to do because of space constraints. Our parking, we have 10 vehicles, which quite frankly, there's really not a lot of parking that is required for general assistance. And then for our India Street Clinic, they're only during clinic hours, and this is ample parking for our clients. There are the metered spaces, but then also staff parking would be in the Spring Street Garage, and staff would walk from the Spring Street Garage. The hours of operation, once again, I kind of went over that. And then the security, I've gone over this before, but I just want to be clear. Security would be stationed at the door for the general assistance and prevention and diversion program. And we have 2 security on staff, and would do perimeter checks around the building. These are not armed individuals. They are not uniformed. They are our city staff that are hired as security guards. Okay, so here's the layout of the building. And hopefully you can all see my mouse cursor here. I'm gonna kind of show you some. This is the Forest Ave entrance right here, and this is the lower level. So this is the door that is right on the sidewalk of Forest Ave. This would be the clinic space right here. And we are working, to look at creating a large waiting room. And also this would be clinic as well as the needle exchange program right here. That's the same way that we have set up at India Street currently. But we're making the beauty of this is we can make the waiting room fairly large so that it has plenty of room to accommodate those who need it. And then there is room for clinic staff and volunteers back here. And so this would be the client entrance. Back here is Oak Street, and this would be the staff entrance in the back. And we also have room for a conference room and then a training room, which we hold CPR trainings. We hold overdose prevention trainings and a various number of trainings. And we all hold SNAP nutrition education classes that could be held here. So there's a variety of uses for that space. And then upstairs here is the upper level. And this is the parking lot right here with the 10 spaces that I was talking about. This would be the entrance up at the top of the parking lot here for the general assistance and prevention and diversion program. The way that we are designing the inside of both floors is so that people don't have to wait outside. We don't want anyone, there's going to be plenty of space in a waiting room. And for this space in particular, we're even doing an overflow waiting room in case that gets full. So there is never a need for someone to be waiting outside for any services at this building. And that is intentional in the design and the layout that we're using. So there's a waiting area, we're having an overflow waiting area. This would be the prevention and diversion offices to meet one-on-one with clients. And then over here is general assistance, and where all the general assistance offices, we need private offices so that they can meet one-on-one with clients and discuss financial information. And then back here is the HHS admin, public health programmatic staff, our financial staff, HR staff would all kind of be in this back area. And once again, this back here is Oak Street, and this would be the staff entrance. Anticipated timeline for this. So I fully admit, and I believe me, the staff feel it as well as myself, or the timeline being what it is. But the June 1 would be when we were looking to have the lease originally start, and we could begin renovations. There is not much renovation. Not much renovation that needs to happen on the GA on the upper floor because of the fact that it's pretty well laid out with all the offices that are existing. There's some work we need to do, the flooring and things like that, but and some doors, security doors that need to happen, but it's very minimal work that would need to happen on the upper floor. And that was the projected renovation time to have GA fully in and operational out of the Forest Ave location for July 1. That was because the Lancaster lease is up the end of June. I am currently working with our landlord at 196 Lancaster to extend that to September 1 to give us some more time, as well as to give some more time for community discussions. And that is ongoing. And we're hopeful that will be able to happen, which would push this timeline back a little bit. Health and Human Services, and we would move to the admin staff, the City Hall staff, the Reiki staff would move to Forest Ave as soon as it's available. And then the clinic renovations would happen over the summer and have the clinic and the 103 India Street individuals moved to this location for November 1, because that is our lease is up the end of October. And that is the presentation. Like I said, it was a brief overview of everything we went over, things that I thought would be pertinent to this group. Happy to answer any questions.
Great,
And
thank
I
you,
also
Kristen.
wanted to say that if for some reason we can't answer the questions today, I'm happy to take emails and then write down the question and we will email you the response.
Thank you, Kristen. I'd just ask participants to use their raise hand or chat function if they have questions, and I'll call them. Jim, you're first.
Hey, let me see if I can adjust this. My video is a little weird. That's better. Thanks. First, a little constructive criticism and then a question. It wasn't that long ago that the city dropped a knowledge bomb on Mason's Corner without much notice. And that meant we had to backtrack everything. Now we're planning on a homeless service center in Riverton. And I think you're trying to learn, but you know, when you're asking people to cluster at services like a shelter or a syringe exchange, you need to let the community know what's happening. You know, and so the question is, first of all, I don't see this as really a hotbed for a lot of the, you know, problematic behaviors that we've seen in Bayside. But as someone who lives downhill of the Oxford shelter, which does a great job with community relations, the thing that has really helped there has been active patrols of the residential neighborhoods, not just the perimeter of the building. And, you know, you're uphill of Bayside at this location too. You know, we've got all these dead spaces, familiar haunts for, you know, unfortunately, the types of things we see: public elimination, you know, discarded needles, aggressive behavior. You know, I don't see the maternal health is generating that, but please think about it better. And the question is, having heard some of the concerns from the community, are you adjusting your community protection plan at all? Thanks.
Thank you, Jim. So a few things. I do want to just address the communication because you're right. We're trying to learn, right? We are. This is absolutely an accelerated timeline. I recognize that. I realize that. And I just, in full transparency and honesty, it was probably about 2 weeks before we went to HHS committee, before our staff were confirmed that this would absolutely work for them. As managers, and we had looked at it and kind of thought a layout for the space. And then staff came in and said, well, you know, this would work. And we had to flip some things. And so the reason we wanted to bring it to Health and Human Services and Public Safety Committee originally is because we wanted to get the communication out there. It didn't have to go to HHS committee as a communication. That's something as staff we wanted to do to start these conversations, to kind of kick off. Are there things that we could have done and that I have learned from previous since then about, you know, maybe emailing abutters right before we went to HHS committee? Absolutely. And I am definitely learning from that. I think we are as staff, but the intention for bringing it to HHS committee was because we didn't want it to go to the full council. That's who needs to approve it. We didn't want it to go to full council without having these conversations first and then really surprise everybody. So I just want you to know that was our intent, and I understand that how it feels, and we are definitely taking I'm taking takeaways for as we move forward. As far as security, yes, we in the FAQ that was updated yesterday and posted on the website on our HHS homepage, based on questions that we've received from the community. One of the things one of the questions is about security and police patrol. Police Chief Clark wrote the response, honestly, and he is recommending that we meet monthly with the police department, HHS staff, with the police department and community stakeholders, quite frankly, to kind of look at what's working, what's not working, are there concerns? That is in addition to what we had talked about with patrols. We will have the same in security on site. We will have the same phone number, 24-hour number, that if there is a concern that happens, like we do down at Oxford Street, Jim, that you mentioned, that we will have that number. And then in addition to that, I will say too that I'm fully open and honest about learning as we go through this. And I was in a meeting, I believe it may have been with Mecca, and individually I've had several meetings, but where we were talking about security over the weekend with the prevention and diversion program being open. And that is something that we hadn't, quite frankly, thought about, because we talked about security with general assistance, and that's where it had always been. And we said, yeah, you know what? We should probably hire a weekend security guard to be there for sure if people are coming in the building. And so we're taking that and we'll absolutely do that moving forward.
Thank you. Kari Morissette, see you have your hand up. You're next.
Hi, thank you. So my question is more on the harm reduction standpoint of this, because I am the executive director of the Church Safe Injection, and I do work with a lot of harm reduction organizations in the community. And my question is, as different cities across the nation are becoming so progressive in the harm reduction standpoint on the war on drugs, why do we feel it's a good idea to put a syringe access program where some people who use drugs would not feel comfortable accessing it, and it will end up causing harm?
Carrie, could you explain more what would be different from our current location, and why you feel that people wouldn't feel comfortable accessing it?
I mean, as a person in recovery who accesses drugs, and from the discussion that I've had with people who are currently using drugs in the area about this topic, for one, somebody who is actively using is not going to feel comfortable going into a building where there's 5 other services provided, where they have to walk past 200 people because of all the stigmatizing things that go on in the world. They already want to hide and feel shame. And then for 2, to have on-site security is going to make them feel like they have to walk by cops, and heaven forbid they should have 11 syringes and be fearful of arrest.
So just a couple of things, Carrie, and thank you for those points, because I think that communication and being clear about the intention of this is really, really important. And how we out in the community communicate it to the clients is really essential. There would be no different. The needle exchange, like I showed on that one slide, would be right inside the door, and it's right on the Forest Ave entrance. You don't have to go up the sidewalk. You don't have to walk past a lot, and that's intentional. We have it so just like is our needle exchange right now at India Street, quite frankly. When you go in, it's one of the first things you see, and you go in, and people are used to. I've worked at India Street. People are used to waiting. Exchange clients come sometimes and wait in the waiting room. So that is something that wouldn't really change for our clients at all. The physical location absolutely would change. There would be no security located at that clinic at that location. The only security would be up at the other entrance that they would not have to go through for general assistance and prevention and diversion. Completely separate entrance. They wouldn't have to go through security, and the security aren't police. They are not armed. They are city staff who wear a City of Portland t-shirt and a vest, a yellow vest. So I think that is something that is considered, but if there are other things, and I know that, Bob, I don't know, we've started to actually talk to our clients of the needle exchange, as well as our clients of our clinics, to talk about any concerns that they may have. And Bob, I don't know if you have results from those yet or not.
Yeah, I think we're trying to be really intentional in how we're gathering feedback from clients and people receiving the various services. So this week we started handing out for people coming into the free clinic program, a very short half-page survey where people can put questions, and we're collecting those, and we'll be collecting those actually on Monday, and looking to see what responses have come in. We're also asking clients of the needle exchange program about kind of the location, any questions that they have, any concerns that they have. At this point, the feedback has, has generally been positive. I think the location is quite central, right on the peninsula, right near Congress Street and in the major corridor. And then I'll also just mention, since I'm speaking, that we're also in the process of, along with the other ways we're collecting information from community members and from clients, we're doing some particular targeted outreach to the New Manor community, and we have a flyer that's been developed, and we're translating it into 8 different languages, which will be distributed out through our community health outreach workers and others. So we're really very interested in getting feedback from clients of the needle exchange program and really all of our services. And we'll take all of that in consideration as we continue our efforts moving forward.
Jim Hall is the hand I see raised.
Hi, not Jim Hall. For some reason, I'm signed in under his account. That's my husband. Yeah, I for one am really very excited for the city about this. I think, I as many of you may know, I live down 4 houses down from the Oxford Street shelter. In fact, I'm looking out at the GA parking lot right now. I'm one of the few people who actually lives anywhere near it, and I just want to address the point about security, because I think that is a really good point about, if it feels intimidating or would be off-putting to clients. And that's just not how it feels here. And this is a pretty intense area. I think a lot of the people who use services feel a sense of comfort, just that there's an eye on the street for them as well. It's not just, protecting residents from people. In fact, Bob just walked by, one of the security guards. They're very unobtrusive. They just kind of wander around, keep an eye on things. Keeps the area kind of clean and safe for everybody. So I can understand that concern, though, that it might feel heavy-handed, but that has not been the experience where I am. The thing that I want to point out to people who are kind of worried about the idea of police calls for service is that I think at the last meeting, the police chief had quoted, I think it was 8 calls for service to the needle exchange on India Street in a year. You can correct me if I'm wrong. I think it was 19 to the GA office. Is that right, Kristen?
It was, I believe it was maybe a total of 8. It was over a few years.
Yeah, right.
Yeah, they're very minimal. I think there might have been actually 4 actual calls for service to India
Yeah,
Street.
because there were alarm issues. Okay. So I guess the thing I'd like to point out to people is, there's no question that there's a lot of activity in the neighborhood around, the GA office and that type of service, but it's not at that location. You compare it, you said under 4 to the GA office. I think it was a little higher, but whereas, the resource center in the 3 years before it closed was averaging 71 calls for service per month. And so that's what people are thinking of, and that's what they're seeing, and that's what they're worried about if they maybe live up on, around this facility and don't have an accurate idea of what's going on. They're individual buildings, they serve individual purposes, and they have individual levels of activity. So this particular use doesn't concern me in that way. The prevention and diversion program, that's the new piece that would be here, new for the DHHS and for the neighborhood. And so that piece, I think, is a little bit different. But the big issue comes when people do have to be sort of waiting around and standing around. And so the improved amount of space for waiting is, I think that's going to be key, and to make sure that it's comfortable and that people actually want to be there. And so I guess a question there is, will you be, I guess, how will you be getting people to be in there and not be sort of, milling around in the area waiting? Some people are just not going to necessarily feel comfortable waiting inside, and that's valid. But, I think that's where some of that issue could come in. And the other question I had, sort of a direct question, was when they end up having to go into shelter, will there be a transportation piece to that as well? The Oxford Street shelters, they're not that far away, but the area that you have to get to them through, it's a pretty simple path, but it can be kind of a fraught path. And so for people, especially just entering shelter, who have not been through that before, I think it could be a little traumatic to, again, be sort of wandering around trying to find your way. And so will there be transportation directly to the shelter if somebody is not able to be diverted?
We've got a couple of questions there, so let me let Kristen get a chance to answer those.
Sure. So as far as, the waiting area of the program, so there will be, we will be encouraging people to wait in there. And quite frankly, with general assistance right now, the way that operates is there really aren't many people actually needing to be in the waiting room because they are scheduled appointments. So they go in, and then with the prevention and diversion program, with the intake hours being what they are, we don't, and these are just individuals who are new to the shelter system, or new to, who haven't stayed at Oxford Street before, or the family shelter. Quite frankly, I just want to be honest, this isn't just for individuals who'll be going to Oxford Street, it's families who will be coming as well. And so this would be, it would be something that we, there are waiting rooms there. And if people didn't want to wait with someone else, we have another area. If someone wanted to sit by themselves and for some reason needed some space, we would have that. There are the 4 offices there. So if someone wanted to sit alone in an office, we can absolutely do that. And then there are also restrooms that will be available to individuals in there. And then also just vigilance, quite frankly, about waiting around outside. There's really no other way to say it. Staff vigilance on site, and helping with clients and learning from, what we need to do there. I would say that when we start the prevention and diversion program, one thing that Jim had asked before about lessons learned, I think when we start this new program, we get some community input about like what our proposals are. The ones that are existing, we can really talk in depth about what we do, but with the prevention and diversion program being new, I think we have some more meetings like this and have some more community meetings to get input about like, this is what we're thinking, what, for the community. And then also around transportation, we absolutely, regardless of where an individual is going, we will be providing transportation, whether it's, our shuttle, if that's going off our van, if that's somewhere else and we don't have that on site, then we would do a taxi or something like that. We have taxi vouchers that we would offer to individuals so that we wouldn't have to have anyone walking through a neighborhood, because they may not be going to our shelter. They might be going to Milestone, or they might be going to Florence House, or they might be going to their own supports, quite frankly. And we would provide transportation for that.
Okay, great. The only other point I wanted to ask about was in terms of the syringe exchange, is that as we know, people who are houseless, they're using typically on the streets in the area around shelters. And so, we have a lot of needle waste in the neighborhood. So is there an education piece about that can either be started or improved where, people just understand the importance of, like, I've mentioned this to several people in the past, is, having a map of the community sharps boxes and locations. And, because people, if they don't know where they are, they can't use them. And increasing maybe the number of boxes available in certain areas where foot traffic would change, because I do think that, there's some folks on like Mechanic and Paris and, the streets that kind of are, if you're coming down Forest, I try to think about the path of least resistance for somebody who's maybe going from the syringe exchange, or someone who's familiar with the system, walking down Forest and then, probably curving off onto Cumberland and kind of, making their way the path of least resistance down the hill through some of those smaller streets. And that's often where people will, kind of stop off to engage. And so,
We've got a question there, so let me
yeah. Oh, sorry. Yeah, I guess the question is
Yeah, let me
needle
let her get,
maps or
yeah.
boxes?
So we've got a hand raised, so I want
Okay.
everybody to get a chance to talk.
Sorry about that.
No worries.
So actually, Bob answered a question very similar to that in the FAQ. So I will let Bob kind of talk to you about what the procedures are for the exchange and good neighbor policy from there.
Yes, thanks. So regarding Sharps boxes, well, regarding the map of Sharps boxes, that does exist. We have that, and we've been discussing internally ways that we can just increase and enhance our efforts at communicating that kind of information to people who use the exchange. So both things like availability of Sharps boxes, where they are, and just in general a good neighbor policy around the fact that we're really kind of enlisting the help of the community, including people who receive services from our syringe services program, related to public use, related to discard of used needles. We do plan to have a Sharps box that will be right available for people at the building. And in working closely with our Public Works Department and our Parks Department, I've been out in the community with representatives from those departments to look to see where those kind of pathways are that you were talking about, or kind of footpath areas where boxes would be helpful to be installed. And we'll certainly be looking at that and putting up boxes as needed, as traffic patterns and such change with the new building here.
Great.
And as far as the box just affixed to the building, that is what we have at our current location at Indiana Street. And that's for if someone comes after hours to return syringes, we want to make sure that there's something on site for individuals, so nothing has to be left discarded. So we want to make sure that there's a safe place to put those after hours.
Okay, great. Thanks. So let's just have a conversation in the future about where neighbors are seeing that activity and where the boxes might go. Thank you.
Thank you. Kari, your hand is the one that's raised. Kari Caria.
It's fine. It's Carrie. So my question
I get
is,
that one, yeah.
where will there be restroom facilities in the waiting rooms for all patients, including the exchange people?
Yes. Yep. Just once again, the intention of this location is to enhance services, not take anything away from what we currently have. And we currently have a restroom in the waiting room at 103 India Street, and there would be a restroom in the waiting room of the clinic and needle exchange area at this location as well.
Any other questions? Hands raised. I see. Let me get to the chat here one moment. I would like to know what Carrie and advocates can do to encourage people to use Sharps boxes, even where drop boxes are known to be endearing Oaks. Users drop their needles feet from the obvious drop boxes.
I mean, I guess I'll answer since that's directed towards me. And I'm pretty sure that everybody in with the city of Portland can agree to this, is all we can do is like make people aware that they're there and ask them to use it. But like, as for us tomorrow, we have a multi-organizational collaboration where we're going down to Deering Oaks, and we have 50 volunteers that's going to walk the entire length of Deering Oaks and clean up the park. other than us doing outreach to help clean up what is left and like letting people know that they're there, it's really out of somebody else's control, unfortunately.
Thank you.
And
Question.
I would just,
Sorry, yeah, go ahead.
sorry, I would just add what Bob had just mentioned too, that we're constantly, we're looking at ways that we can continue to engage and enhance our efforts for that as well. We definitely recognize that that is a concern that we're seeing, and there is an analysis that's going on about perhaps why certain boxes aren't used. And I've looked. We get a monthly report of syringe waste that is picked up in the community, and what boxes are frequently used and what aren't. And we're looking at that, and we're trying to figure. We're going to work with clients of the exchange and others to try to figure out what's working, what's not working, and why it perhaps isn't working. So that is definitely in the works as well.
And I would also just like to add that the LD 994 testimony hearing that we had the other day was unanimously in favor, and in hopes to decriminalizing syringe possession. People are not going to be scared to have over 10 and be like inactive using and be fearful of arrest and throw them out of fear. So hopefully with the decriminalizing of hypodermic apparatuses, we will start to see less and less syringes just thrown away.
Thank you. Of the 20 to 30,000 needles distributed monthly, what percentage, sorry, that's going fast, do you anticipate being distributed through the new facility?
I would say that it's this current numbers for the exchange, so it would be the same. I don't know. If this question is looking to the breakdown between our outreach, the numbers we give out in outreach compared to what we give out at the exchange proper. I don't have that. I don't have that answer off the top of my head. I don't know if Bob does either, but we can absolutely look at that information.
One of those things we can maybe add to the FAQ or get back with, I guess. One moment, see a chat. Is there a sense of how many people will be serviced on an average day and how many staff will be on site? Will that change as the pandemic winds down and the P&D program wraps up? I'm trying to get a sense of the increased people and traffic in the neighborhood.
So that's one of the questions that we received for the FAQ that we are still working on as staff. So you'll see in the FAQ that not all the answers are uploaded, but I'm getting a historical average for what individuals, for how many individuals we serve at the various locations. I am going to let Ryan just talk briefly about on average how many clients they would see, and as far as the phone services, if it's working well. I don't think we change it after COVID, quite frankly. I think people prefer it. So I'll let Ryan answer that, and then I'm going to get some numbers from our clinic numbers.
Morning. So general assistance is very busy. We do a lot of services out of that program. When we look at just general assistance, last year we had an average of, we saw a total of 14,000 applications. And at first that number sounds very large, but that is not really the case. A lot of times somebody's applying for some sort of need that could be an emergency need like food, non-food, et cetera, but then they're coming back and they're getting a medication. And so each time they're putting in a new application, that number is being counted. We've moved to everything to be on the phone for the most part. There's not a lot of in-person. And so that's working. We're going to try to maintain that. And so the foot traffic, when I think about the foot traffic, it's the same community members that are traveling the path to get to us. And it's the same community members that are boarding the buses at those locations. Again, I don't think that we really need to look at increasing that number per se. if it's working the way it's working and we're meeting the needs of the community, I think everybody's committed to having it maintained this way.
And for public health and the services, so on our Health and Human Services homepage, I keep saying go to the homepage, but we're trying to put as much information out there for the community as possible, quite frankly. And there's a section there's a table on there that talks about the services that that we offer and the number of people that we serve. And that's updated weekly. It's been up there for a while now. But just so on average, just so so we can get a feel before we fully answer that email, answer in the FAQ. Last week, we served 24 individuals at the Portland Community Free Clinic. We served 20 individuals at our STD clinic. And for the needle exchange, there were 72 on-site exchanges and 65 were done at outreach. So there are those for public health, those would be the in-person kind of things that you would see.
Other questions? I'll look into, Jim, I see your comment. I'll look into that. Do we have any other hands raised? I'm going to give this a going once, a going twice. Okay, I'm going to assume that is everybody. I want to thank everybody for their commitment to their community before we let go today. I know everyone here is getting up early in the morning to be a part of these conversations, and that takes dedication and commitment to your town. So on behalf of Portland Downtown, we thank you for that. I thank everybody for their very rational discussion here today. And we're happy to facilitate these. So in the meantime, keep an eye on the FAQ and stay in touch. Have a good weekend. I think it's going to be nice today.
Carrie, I would just
sorry, yeah.
No, it's fine. But if there are questions that individuals have that you might think are too in the weeds for a forum like this, please do not hesitate to reach out to me or our other staff, and especially me, and I can field those questions. I'm happy to schedule a meeting with individuals, with organizations, or just answer questions via email. We will put them in the FAQ. Feel free to go there. But honestly, if it's more of a conversation that you would prefer, I am more than happy to have that conversation. So thank you. And thank you, Carrie, for hosting this. We really appreciate it.
Glad to do it. Thanks, everyone. Go Red Sox.